everyone, and lovely to be here through the day listening to healthcare thought leaders talking about how we can redesign the healthcare ecosystem for the future of India. I am Mansi Wadhwa Rao. I head a team called Growth Programs at Medtronics. This is a team that drives partnerships, and I am also co-chair for the South Region chapter for Nat Health, the Healthcare Federation of India. Now, through the day, one topic that I've heard in every presentation, every panel discussion is partnerships and collaborations. And I'm so happy and thankful to ET team to allow me this opportunity to talk about the healthcare technology perspective in all of this. Let me start by talking about the role that medtech has been playing. Most of you would know Medtronics is the world's largest medical technology company, but it started through a partnership between a cardiothoracic surgeon where the company created the first battery-operated pacemaker. And over the years, with a lot of investments in innovation and a lot of more partnerships, we have looked at treating almost 70 different disease conditions. When I joined the medtech industry in the spine surgery space, let me be honest, outcomes were nothing great. And over the last 2 decades, with a lot of experience, surgical expertise, and technology, today we have everything from preoperative planning to intraoperative image guidance, nerve monitoring, robotics, and intra-op 3D imaging. And the impact is there for all to see. Today we can treat in India the most complex deformity conditions. We do the most degenerative cases in minimal invasive manner. And if you look at the last couple of decades, the biggest innovations, disruptions, and continuous innovations have been towards how do we treat more conditions, how do we treat more complex procedures, how do we give patients a better experience, how do we improve the physician experience, right? If you talk about TAVR, how surgical valve replacement can be offered to patients who would not generally take a surgical procedure. They have comorbidities or their age does not permit it. Or if you look at the latest generation closed loop insulin pumps, which are really pushing the edge in terms of glycemic control or in terms of time in range touching almost 100%. But I think India has also a big role to play in this, into the future of technology when it comes to software, AI, quality and validation. But we are at a pivotal point. Do we continue as a medtech industry to look at treating more conditions and offering better experience to patients? Or do we now look at how technology can solve for healthcare barriers? And that's the pivoting point at which we are today standing. So for the rest of my presentation, I will focus on, sorry, I'm having trouble with the slide mover, yes. So for the rest of the presentation, I'm going to talk about how healthcare technology companies like us can play a role in solving for access, affordability, and other healthcare barriers. So let's take stroke as an example. Now, earlier in the month, we had a National Stroke Summit in Delhi, and the Honorable Minister, Dr. Fozo, was talking about stroke being the largest, public healthcare burden, and we as the healthcare system have to be ready for it today. Why is that so? We carry 10% of the global stroke burden, and the treatment penetration is only 1% or less than 1%. The reason for that is patients are not aware, they don't realize that they are having a stroke. There are delays in diagnosis, there is delay in reaching a healthcare facility at the right time. Even after reaching a hospital, which is stroke ready, there are delays in the care pathway, and then eventually we have only 200 neurointerventionists in the country available. So let me bring out some ideas, but also some actions on how do we address these barriers through partnerships. So let's talk about capability first. With the government of Tamil Nadu, we have started working on empowering medical colleges with neurointervention capabilities. So here on screen, you see, the health state minister looking at a neurointervention simulator model, and we are building this capability across the state. Once the capability has been established, how do you, optimize the care pathway? So in 2020, we had a partnership with Apollo Group of Hospitals where we brought in AI into the entire diagnosis chain. So once the patient enters the hospital, how do we bring the diagnosis time down from 60 minutes to 2 minutes using AI technologies and helping the interventionists who may not even be available in the hospital at that time. And finally, the third aspect, once a stroke center is ready, how do we impact more patients? So we had a partnership signed with Aster MIMS Hospital, for example, in Calicut, which is a WSO recognized stroke-ready center, on building a hub and spoke network wherein more patients can be positively impacted by the capabilities that already exist at this center. And finally, quality. How do we bring quality at the core of the stroke care? So again, a very important and pivotal decision that happened just a fortnight back, where WSO and NABH signed an MOU to jointly create a certification program for stroke centers so that the care is delivered with the highest quality standards, and Medtronic is supporting this program at the forefront. From the government perspective, also positive developments around inclusion of mechanical thrombectomy into the Ayushman Bharat packages, and a significant threefold increase in the package rates of 5 lakh, which is now being implemented and adopted by very many states. So I think coming together, I'm very positive about how these partnerships can transform and help us in our ability to tackle stroke, and leaving you all with a few more thought starters on other areas where we as a healthcare technology company and me as a representative of the industry can look at other public health concerns. I believe partnerships is the only sustainable way forward to address these healthcare barriers, and look forward to collaborating with you. Thank you so much.